afternoon, everyone. Welcome to today's episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. November happens to be Diabetes Awareness Month. So joining us today is Adriene Sanders, a Nashville General Hospital pharmacist and a certified diabetes care and education specialist.
Adriene is a graduate of Tennessee State University and received her Doctor of Pharmacy from the University of Tennessee Health Science Center. She is a member of the Middle Tennessee Association of Diabetes Educators and the American Society of Hospital Pharmacists. Please welcome Adriene.
Thank you. Thank you, Kathy. It is a pleasure to be here. And thank you for the opportunity. I am going to, if all is well, just give me a nod, Kaylin and Kathy, then we'll get started. So as Kathy and Kaylin, as they noted, November is American Diabetes Month, and today I'd like to talk to you briefly about behaviors that contribute to healthier outcomes. So while we're bringing awareness to diabetes during the month of November, the behaviors sort of speak to patients who, or people who already have diabetes, or maybe even pre-diabetes. There are three things I want to draw your attention to, just as well in the vein of awareness. Is the first website is just a risk test. It's a 60-second risk test. And the second one is the diabetes.org website, where you can get information on just general information about diabetes, types of diabetes. There's just a variety of information for you. And then the final thing is this is published by the CDC, and it is just a snapshot, and it's diabetes in our nation. So it's very easy to read numbers on where the numbers nationally, as well as pre-diabetes numbers, as well, risks and so forth. So hopefully at your convenience, you can take a look at those, and I'll go back if I need to. So the objectives today are to introduce you to the 7 self-care behaviors, and that's the Association of Diabetes Care and Education Specialists, 7 self-care behaviors, explain them. And so we'll just hit the surface. We'll just tip the surface of all 7 of them. And then to identify the benefits of behavior change and how it can lead to healthier outcomes. So what are these self-care behaviors, these 7 self-care behaviors? So they were established in 1997, and the organization was formerly called the American Association of Diabetes Educators. And they were challenged by the CMS to define a unique and measurable outcome of diabetes education. And that was identified as behavior change. Behavior change is measurable. And so the 7 self-care behaviors were identified as activities that promote successful and effective self-diabetes management. Drawing some attention to self-management is having diabetes. Approximately 80% of it is self-management. There's clinicians who help us on the clinical side, and they rely on the information. They rely on us, and I also have diabetes. We rely on us to do what we have been, I guess, what the plan is, follow through on the plan. So self-management is very important. Let me make one change here, ladies, real quick. Okay, here we are. 7 self-care behaviors. There's healthy eating, healthy coping first, healthy eating, being active, taking medication, monitoring, reducing risks, and problem solving. So let's just start with healthy coping. Now, living with a chronic health condition can have its challenges. So healthy coping, it just refers to having a positive attitude towards diabetes and the self-management of diabetes, just about positive relationships and quality of life. Now, healthy coping is critical, and this is in the achievement of the other 6 behaviors we'll talk about. Optimism, positive affect, self-efficacy, and gratitude. Self-efficacy is just having confidence in knowing what you can do. So you want to find out what you can do and do it well. But they're all associated with better outcomes in diabetes and many other chronic health conditions. So just to give you just a couple examples of healthy coping. So just participating in face-based activities, just being physically active, just move. Increasing the self-efficacy we were talking about, just figure out what you can do and do it better, or just do it well. Finding a hobby. Drawing attention to the unhealthy coping. So just say with the first 2 things here, avoiding people and situations and just not finding time for activities, just simple avoidance is an example of unhealthy coping. Overeating, drinking alcohol, smoking, taking drugs are all unhealthy coping mechanisms. Healthy eating, number 2. So healthy eating just refers to eating a wide variety of foods, nutritionally sound or nutritionally dense, that promote good health and wellness. So barriers to that can be just the barriers around food and eating. They can be influenced by just food preferences, cultural preferences, food security or insecurity, health beliefs, and just eating habits that maybe you've developed already, as well as your wellness goals. So there's some simple things to know outside of seeing a dietitian, but I would request just seeing a registered dietitian. And so healthy eating and just knowing how to read a food label. And just the example here is drawing your attention first to serving size, which is 2 cups. And for a diabetic, especially the diabetic who is carb counting, we can do this 13 grams. So in 2 cups, you get 13 grams. That's beneficial information for the diabetic who is carb counting. For the type 2 diabetic or someone who is not on insulin, this is just an example of the plate method. And the plate method is an example of an adult plate, which would be 10 inches. The recommendation is 10 inches. And you check your plate when you get home, I'm sure it's not 10 inches. But here you simply divide this plate in half. 1/2 of the plate is vegetables, 1/4 is your protein, and the other 1/4 is your starch. Healthy eating just in general is believed to, and studies have shown just a decrease in A1C. And in some cases, you hear up to 2%. So I wanted to just mention, along with carbohydrates, protein, and dietary fat, they're all the consumption of them are all part of daily living. There are recommended diets, the DASH diet or Mediterranean diet, but there's no single diabetic recommendation. The distribution of all 3 things mentioned, they're based on the individual's caloric and metabolic needs. Number 3, being active. Being active. I want to say very important, is medical clearance is recommended and required before starting an exercise regimen. There are some health conditions that there requires an extensive warm up and extensive cool down. There are certain health conditions that where fluctuations in blood pressure can somehow exacerbate them. So medical clearance is recommended. But for the American Diabetes Association recommends 150 minutes per week of moderate aerobic activity, missing no more than 2 days. And with those 2 days, there's a prolonged effect or a delayed effect. And then also with resistance training, and that's about 4 hours per week. Being active just can not only help you to manage your blood sugar, but your blood pressure, your cholesterol, and it improves your body's ability to use its own insulin, reduce the risk of complications of diabetes, reduce stress, increase or improve your mood, and promote weight loss. So there's simple things you can do that may not require a medical clearance with just to start at home. Gardening, cleaning your house an activity. At work, you can walk at lunch. You could even walk between meetings. Consider buying a pedometer just to give you some idea of how many steps you're making on a regular basis. Number 4, taking medication. So we all know medications are an essential component in the management and the prevention of chronic health disease. And they're the different routes you can use. But you talk to your healthcare provider, talk to your pharmacist, or someone like me, who's not only a pharmacist, but a diabetes care and education specialist, to learn about your medication, what it's for, how it works, and side effects, and maybe even any drug interactions. Some helpful tips here. Just take your medication. I know it seems really simple, but take your medication. And that's for the other chronic health conditions that you may have. Don't make adjustments or omit doses until you have specific instructions to do so. For the diabetic who may use insulin, just don't associate it with advanced disease or maybe even being a failure. It's a treatment option. Dosages for one diabetic may not be for the other. Your diabetes is not necessarily like my diabetes, so our regimens may have some similarities, but they are individualized. Keep a medication list, an update medication list, and that would include OTCs as well as or over-the-counter medications, vitamins, and so forth. So the thing to do would just to be establish a daily routine, a daily practice. This way, fewer things will be forgotten, and it'll just become a part of your daily living. The 5th one is monitoring. Here is just an example of a glucometer that we have seen, or we may even use on our own, and this usually requires pen and pencil. It sometimes can lead to misreporting, and that's either unintentionally or intentionally, depending on your frame of mind. But a glucometer. Another option is the Dexcom CGM, and this gives the diabetic a little more autonomy. It enables some shared information with your doctor's office or your provider, where you don't have to report. And here's another option of the CGM, which is the Flash CGM, the Freestyle Libre. Monitoring I'm speaking to the diabetic and monitoring blood sugar, but it goes beyond blood sugar. And so as diabetics, we need to understand we need to know our blood pressure. We need to monitor our blood pressure. We're already watching what we're eating, and we're looking at our weight. We're taking our medication. We're examining our skin. We're looking at our feet. We're trying to look at the bright side of things, and we're getting good rest. So monitoring of blood sugar, the monitoring goes beyond blood sugar, and it acts as a springboard to the other behaviors. And so understanding what's going on and knowing what's going on gives you, it's a roadmap to how the next thing to do. Number 6 is reducing risks. So reducing risks is just simply implementing behaviors to minimize or prevent complications or adverse outcomes. So the American Diabetes Association, the Association of Clinical Endocrinologists, they all provide standards of care and with evidence-based information to promote health and to decrease risk for people with diabetes. Act early, and that comes through regular doctor visits. Participate in the self management education and support. Just take a diabetic education class. Aim for adequate sleep. So increased blood sugar levels are associated with lack of rest or inadequate rest, especially from sleep apnea. And the thing to do would be to plan and do. As a diabetic, we just have to know, our ABCs. The ABCs of diabetes is your A1C. Know what your A1C is, and there's goal setting involved with that. Blood pressure, know what your blood pressure should be, as well as your cholesterol. This is just an example of the complications of potential complications of uncontrolled blood sugar, diabetic complications, and simply put, uncontrolled blood sugar or uncontrolled diabetes can pretty much affect you from head to toe. I mean, just literally in a literal sense, from head to toe. We hear about complications with sight and kidney function. Just being diabetic puts you at cardiovascular risk. We don't hear as much about the stomach, but just as well as there can be neuropathy that causes pain in your feet, the peripheral neuropathy, that affects your nerve, the tingling you can get with your feet. You can also get a neuropathy in your stomach, in your gut, and it's called gastroparesis, and as well as dementia. So I'm sure the smokers out there, you're probably tired of hearing this, but this is something we as a healthcare provider and as your healthcare provider, as reducing risk, the advice for smokers. If you smoke, the American Diabetes Association recommends that you quit. And you can talk to your healthcare provider as the best way to do that. So here, the following are some recommendations on some things you can do annually. It's a foot exam, a urine test. And we mentioned acting earlier. Through this, you can actually detect any early signs of kidney damage. Annually, a dilated comprehensive eye exam. Annually, your doctor may want to, or your healthcare provider may just want to do a lipid panel. They may ask you to do this fasting, but you get to see what your total cholesterol is, as well as the bad cholesterol and the triglycerides. Your A1C is something that may be done a little bit more often, depends on your level of control. Get blood pressure checks with every visit. And once a year, the flu vaccine is recommended, as well as the vaccine for COVID-19 plus its booster. Number 7, and the final one I want to mention today is problem solving. I chose this particular picture because I was told by an old professor that treating diabetes is like trying to hit a moving target. And being diabetic, I know this to be true, but the thing is to try to hit it, and it starts with you. Problem solving just refers to a learned behavior that includes generating a set of strategies for problem resolutions. One of the most important problem solving skills a diabetic can have, especially if they use insulin or even if they don't, is to know how to recognize high blood sugar and how to respond to a high or low, and how to respond to a high or low blood sugar. But there's no perfect diabetes self-management. There will be challenges, but the important thing is to learn from each situation. So you can participate, the patient being in the center, you can participate in shared decision-making and goal setting. Problem solving, you can actually think about this. Okay, are you sick? You know, what's happening now? Do you have a sick day plan? If you don't, I would urge you to talk to your healthcare provider to get one. What has happened? You know, is there a change in medication? Are you changing where you eat? New job, new insurance, just some life status change. Another thing is what is going to happen. You plan to vacation, you plan to travel. You can travel with diabetes. You don't get to have a vacation from diabetes, but you do travel. You do travel with diabetes, and there's a planned way you can do about it. Holiday celebrations, we are in the holiday season. And so there should be some planning and some goal setting at this point. Just to recap, our 7 self-care behaviors that are believed to contribute to healthier outcomes: healthy coping, healthy eating, being active, taking medication, monitoring, reducing risks, and problem solving. So I want to leave you with this. Excuse me. So live well with diabetes. You can live well with diabetes. You are in charge. And what I mean by that is, you know, you are in the driver's seat. That's what I mean by that. Your healthcare team may be experts on diabetes, but you are an expert on you. Remember, as your life changes, your plan may need to change. If your plan isn't working for you, then it may be time to change the plan. You're worth it, and your health is worth it. Okay, ladies, I have completed the presentation, and I am here for any questions.
Well, thank you, Adrienne, for your presentation. I definitely have learned more about how to healthy behaviors and how to live a healthier life, especially in regards to diabetes. Because I think a lot of times, and I appreciate that you are living with diabetes as well. You're very empathetic to the conversation. I think a lot of times people are like, you know, what do I do now? Or when I have family members, my dad is actually type 2 diabetic, and we found out, I think 2 years ago, when he was unfortunately admitted to, you know, the ER and then, you know, over to the ICU. So it had gotten to that point before he had known. So I definitely appreciate, you know, you kind of towards the end, like you talked about, taking the fear out of it, more so just making yourself more knowledgeable, whether you're a family member or friend, but just understanding is the best thing. So
Yes,
we
thank you.
are welcoming questions right now. So if you have, I am monitoring the Facebook chat if anyone has a question for us, but I will let Kathy kick it off.
Thank you.
Thank you. That was some incredible information. And to Kaylin's point, you know, you were referencing how those of us with diabetes, and that's really important, so people know that they're not alone and that the person they're getting the information from is walking the same walk that they have. So you had mentioned things about carb counting. Is that something that is only for the diabetics who are taking insulin, or is that something a doctor would recommend? Or can you talk more about why someone would carb count?
Yes. So carb counting is not necessarily for someone who takes insulin, but that is pretty much their knowing their carbs is how a person with insulin who takes insulin knows how much to take based on, and this was probably calculated based on information gained on blood sugars that were taken after a certain amount of food, and it was calculated. And you know, it's something that can change. But someone who does not take who does not take insulin, excuse me, who has diabetes and doesn't take insulin, that may actually be part of their, I guess, a meal plan. And so when I gave you the example of the serving size, and so if we are to look at a food label and look at the serving size, we get the serving, but we also get the carbs. And so based on, we would hope that someone out there will, I hope this conversation sparks change, and we can keep our dietitians busy. And but based on a meal plan, they may choose, based on the patient's level of understanding, they may choose to use that as a meal plan maximum per day. And so I don't mean maximum as in limitation, but I do mean, we can't just eat even if you're not diabetic, you just can't eat what you want to eat when you want to eat it all day. We can't do that. And so based on the caloric needs and metabolic needs of the patient, those carbs can be counted for someone who does not take insulin as well.
And we have a question in the chat. So can you reverse diabetes?
Well, I would say it would really depend. And so hopefully you guys can have some time to look at the websites mentioned that I listed earlier, and I can put them back up if you need to. But at that website, you'll be able to find risks. And so one of the risks, and there are a few, is being overweight. And so there have been times where a patient loses a certain amount of weight to where they no longer have to take diabetes medication. Now, someone like me, I have to ask, someone like me, now you can't see how big I am, but I am someone who is type 1 diabetic, type 1 diabetic. And if I will be diabetic, even if I lost 20 pounds, and it is an autoimmune disease that my pancreas just doesn't work anymore. And so for the type 2 diabetic, it is more likely to be reversed through the healthier lifestyle. I hope that answered your question.
No, that was perfect.
I hope that answered that question. Okay.
No, that was perfect. That was perfect. So I guess not necessarily, but going back to the carbohydrates and the healthy eating. So, many times when people are trying to eat better, for whether it's dietary restrictions or just want a healthier lifestyle, we always hear, eat your fruits and vegetables, eat your fruits and vegetables. But we also know, why is it okay to eat fruits when they are full of carbohydrates? Like, are there some fruits that are better than others while you're living with diabetes? Or is that something that someone should be concerned about?
Well, I tell you, I would reach out to a registered dietitian and get really specific information on those nutrients. But speaking to carbs, there are carbs and we need carbs for energy. And believe it or not, insulin, we hear about insulin and carbs, but you need insulin for to metabolize protein and fat as well. It just doesn't require as much. But when it comes to carbs, we need the carbs for energy. And you can choose an apple, you get carbs, you can choose a Snickers. And so it would be the choice, the healthier choice. So yes, there are sugars, there are natural sugars, and yes, it will increase your blood sugar, but to the level varies. A complex carb like a candy bar, chips, and that kind of thing, your blood sugar will rise, but it will rise faster, higher and faster, as opposed to the apple, where you do get carbs and you will get a blood sugar increase, but it will not raise it as high.
Thank you.
You are so welcome. Thank you.
You had also talked about the ABCs, know your ABCs, your A1C, your blood pressure, and your cholesterol. And then a little while later, you had said the A1Cs need to be checked every 3 to 6 months. So is that, if you feel you might be, like, you go on and take that risk assessment on one of the websites you showed, And if you feel like you might be at risk for diabetes, is this something you call your doctor and say, okay, I need to have these tests and then I need to come back in 3 to 6 months and let's run them again? I mean, to be proactive in your health, because a lot of what you're talking about, I also, heard about the self-care, the behavior that you really have to take control of your own health and be your health advocate.
Absolutely. That is so true. And so there is a risk. Hopefully our friends who have tuned in will go to the risk assessment, and hopefully their annual physicals. There are risks there that may apply. Hopefully that person will see, and those labs you mentioned, as far as the A1C, the cholesterol, you take your blood pressure. And I know we all go to get our physicals. One of the first things they do besides weigh us is take our blood pressure, so that's something that, but the labs, it may actually be part of your annual labs if you have been identified, and that's ethnicity, is a risk factor as well. And if you have been identified as having a risk, those labs may be part of the annual an annual physical or the annual check. But when it comes to 3 to 6 months for the diabetic, so if you are a little more controlled, then that's something you may not see your doctor, but every 6 months. If you are not as controlled, then you may have to go a little more often.
And then, thank you, Adrienne. We actually have another question in the chat. So when prescribed insulin, will a person need to be on insulin forever? Or is there an alternative to insulin like pills?
Okay. So it really all depends. For someone, I just use myself as an example, just because I want our friends here at NGH and out in Facebook land. I'm living with diabetes. I'm living in it and learning it. But someone like me, I'll have to take insulin for the rest of my life, because my pancreas, which is where it comes from, it does not produce enough. Now, if I lose weight, if I change what I eat, my requirements may decrease. Now, for someone who is either thrust into diabetes as a type, just say through DKA, which is an emergency, they may require insulin for the rest of their life. But then if they lose weight, and I want to say HHS, I'm sorry, I'm getting the health conditions. I'm getting the health conditions confused. If someone comes into DKA, they're more likely to be type 1. There's another health condition that there's also a healthcare, it's a health emergency, HHS type 2. Those risks, especially if they're obese, they could be on medication. There could be a variety of things that could be going on hemodynamically, where insulin is required. But as their health improves, as their hemodynamic status changes, and even if, just say with that, for that person who goes home on insulin and they're on steroids, can increase your blood sugar. The insulin, you may not have to take it, but for someone, you may take it for a while, but then you may be able to come off. But for type 1, you'll probably have to take insulin for the rest of your life. A type 2 diabetic may or may not. That may be reversed, but it does take work.
Thank you. And then my next question is, so can your menstrual cycle and or going through menopause affect glucose levels?
That's a good question. That's a good question. I don't think the two are related physiologically. when it comes to menopause, that's something that I would really have to research. And I don't know if I'll be able to answer that person's question. But the first thing that comes to mind is, it all depends. It may fall under a patient and their sick day. And so what I mean by that is that some patients go through, some women go through menopause and you don't know, they don't have the hot flashes. I do know there is a hormonal change, but I don't think that hormonal change is related to blood sugar levels directly. But if that person is very symptomatic and it makes them ill, and I want to say, I don't know how debilitating hot flashes are or whatever else you go through when it comes to menopause, to where you're eating less. It may fall under a sick day, to where you may have to follow your sick day plan. But I don't think they are, and I'll really have to research that. I don't think they're physiologically related though.
Well, thank you. And I think, let me make sure we don't have any other questions in the chat.
Mm-hmm.
Let me make sure. Okay, well, that is all the time we have for today. But I would like to first thank you, Adriene, for speaking to us in regards to healthier outcomes and healthier living and things that we can support others with doing when it comes to diabetes and diabetes awareness in general. Kind of like I said in the beginning, I think a lot of times when you hear about diabetes, it can be such a anything when it comes to health, people kind of get nervous about. But I think definitely this conversation healed and made a lot more people empathetic and sympathetic to diabetes. So thank you very much for explaining everything in the way that you did.
Thank you so much. It's a pleasure to be here. Thank you.
And if you have any additional questions, please continue to comment, or even feel free to direct message Nashville General Hospital on Facebook. We'll be sure to send all of those questions to Adriene after this session is finished recording, to make sure she has them and they're available to her. If you need to schedule an appointment with a primary care provider to look into if you are type 1 or type 2 diabetic, or any additional questions you may have, please contact us at 615-341-4968. Once again, if you would like to schedule an appointment with a primary care provider or have any of your questions answered further, please contact us at 615-341-4968 or visit our website at nashvillegeneral.org.
Again, thank everyone who joined us today. Get those meal plans for next week. Thanksgiving will be here before you know it. And also, Adriene had mentioned the effects of smoking. Tomorrow is the Great American Smokeout. So any smokers out there, we challenge you to give up cigarettes for 24 hours starting tomorrow. And please join us for our next Wellness Wednesday event on Wednesday, November 24th at 12:15. Have a great day.
Have a lovely day, everyone.